Hello and welcome to Pregnancy Info. Today we will discuss the causes of low sex drive after delivery. Causes, its treatment and all about it. You are arrived for your 6-week postpartum checkup. Although you just had a baby, you feel like this appointment is supposed to mark the end of your postpartum journey. So you are shooting all over yourself. You should be better at this mom thing. You should have lost weight. You should have figured out breastfeeding. You should have your routine settled. You should have your sex drive back. Oh, that last one is really doozy. There are plenty of totally normal reasons why you are not back in the mood. Let's talk about 8 of them. Number 1. Postpartum hormones. The postpartum hormones are not libido friendly. Postpartum is a whole whirlwind of hormones. For example, decreased estrogen, increased oxytocin, prolactin, etc. Number 1. Decreased estrogen. While we see this as a nuisance, decreased estrogen is evolutionary. It's how your body ensures that you are not in the mood so you can fly, heal and invest in the baby you just had. Increased oxytocin. Oxytocin is a bonding hormone. It is released when you hug, have sex and breastfeed. With all the snuggling and feeding you are doing these days, you are being overwhelmed with oxytocin. You don't need to have sex with your partner to get it, so you are less likely to be in the mood. Prolactin. This hormone prepares you for breastfeeding, and while it's great for relaxation, it's not good for your sex drive. Once again, evolution is at play. Increased prolactin in your body's way of making sure you remain focused on your new baby instead of literally anything else, including sex with your partner. Number 2. Sex is painful post-baby. One of the less than sexy side effects of your hormonal roller coaster, vaginal dryness. This makes sex anywhere from mediocre to totally painful, and you have had extra complications like episiotomies, C-section, stressed perineum. You are likely to experience more pain than trying to do the two. Number 3. You may be experiencing a PMAD, postpartum mood and anxiety disorder. Affects plenty of new parents, especially moms. They include things like anxiety, obsessive compulsive disorder, post-traumatic stress disorder, psychosis, and depression. Postpartum depression is the most common PMAD, affecting up to 40% of all moms. And while low libido isn't necessarily a surefire sign you are experiencing PPD or other disorder, it could be a symptom. Number 4. You may feel self-conscious. Our bodies change a lot during pregnancy and postpartum, and society isn't exactly kind to those new bodies. You are left feeling like squishy, lumpy shells of our former self. You may barely recognize theirs in the mirror. That is a lot to take in. So the last thing you may want to do is to show your new body to someone else, particularly to someone who found your pre-baby body sexy. You are worried. What will they think now? Number 5. You may feel tossed out. Since giving birth, you have likely had someone attached to you all day. Whether it's a breastfeeding baby or a clingy toddler, you haven't had your body to yourself in what seems like forever. That leaves you feeling used, invaded, and even violated. The last thing you want to do is to give up your personal space after a long day of caring of your child. Number 6. You are too busy to get busy. If you are supposed to nap when the baby naps, keep a clean home, care for other children, work, and maintain a social life all at the same time, there seemingly is no time for sex. In your pre-baby days, you might have flung all that aside for a little spicy bedroom time, but now your priorities are wildly different, and that's to be expected. Number 7. You are so tired. Insufficient sleep can lead to decreased libido. You are spending every drop of energy putting into your children, especially in that newborn phase. It's no wonder you are having trouble finding the energy for sex. Number 8, you are nervous about getting pregnant again. Maybe your pregnancy experience wasn't all rainbows and unicorns, or maybe you just can't imagine adding another baby to your family. Whatever the reason, you might be avoiding sex because you don't want to get pregnant. Now, we will explain you 6 ways that can slowly promote post-baby intimacy. There are plenty of reasons why you are not having sex right now, and every single one of them is okay. Be kind to yourself as your libido naturally returns. But if you are looking to introduce intimacy back into your relationship sooner than later, try these 6 tips. Number 1, be patient with yourself. Most women report that decreased libido is temporary, anywhere from a few months to a year and a half postpartum. Remember, this change isn't permanent and you will likely return to your baseline soon. Number 2, keep communication open. Many partners have difficulty with the post-baby mismatched libido. It's important to be honest with them about all the reasons you might not want to have sex. This helps your partner feel more confident that it's not them, it's everything else going on in your inside and outside. And by talking about the reasons you're not in the mood, you're being vulnerable and kicking shame to the curb. Communication is also important to break the tension when you do decide to get intimate. Talk about your physical changes, how it might feel to have sex, and anything else you might be worried about. This can help you relax and feel more comfortable with your partner. Number 3, get childcare. Even if it's just for a couple hours during the week, getting some help with your kids can mean the difference between sheer exhaustion and functional adulthood. And when you are not exhausted, you might find you are more interested in sex. Number 4, use tons of lube. Seriously, the vaginal dryness is super real. Make sure you are using plenty of lube to make your transition back to intimacy more comfortable. Number 5, get intimate in other ways. Look for ways to create intimacy outside of sex. Hold hands, kiss, and touch each other in non-sexual ways. This can slowly reintroduce both the sexual and non-sexual ways you and your partner may be intimate and close to one another. Number 6, make time for sex. If both you and your partner want to make sex a priority, do it. Carve out some time for just the two of you. Again, you are worth it. You are not broken. Promise. A decreased libido can make you feel broken, but you are not. This is the normal, expected part of the postpartum experience, and you can get through it. Hope this video will help you to get out of this problem, and if it's done, then must share this video with other females who are suffering from this problem and not asking anyone about it. Thank you.